And oh, by the way, eat less and move more. And when they came back in 3 months and their diabetes still wasn't controlled, their blood pressure still wasn't controlled, they probably gained weight. Well, that's obviously they weren't listening to my advice, right? But actually, I wasn't giving them any appropriate tools on how to, first of all, eat less and move more doesn't work. Exercise does not help you lose weight. Exercise is critically important to good health, but it's how you eat that has to do with weight. I found low carb keto way of eating. It's interesting because prior to that, I kind of felt like I had to be hungry for something to work. So if I wasn't hungry, it wasn't going to work. But of course, because I was hungry, I always gave it up. And when I found this way of eating, it literally felt like magic because I was full all the time and able to lose weight.
Is everything we've been taught about diet and nutrition a lie? I'm talking about dietary recommendations, the low-fat foods that were very prevalent back in the 1980s, and the now notorious food pyramid. Is it all lies?
Well, they're certainly not based upon rigorous evidence. Really, it was pretty much a single man who kind of started the whole movement, Dr. Ansel Keys. I'm sure you've talked about him. Unfortunately, he's not alive to see what's happened based upon his dietary guidelines. But certainly, if you look at all the graphs that exist, the inflection point really is in the 1980s when we got the very first dietary guidelines, the food pyramid. And prior to that, diabetes was not a very common disease. And since that time, I mean, 1 out of 2 people has diabetes or pre-diabetes or insulin resistance, and diabetes and obesity have absolutely skyrocketed based upon those recommendations. So yeah, maybe to answer your question.
It's amazing when you look at photos from the 1950s, 60s and 70s, especially large groups of people. I saw a picture yesterday that was taken on a beach in America back in the 1970s, and not a single person in that crowd could be deemed to be obese by today's standards. So it's astonishing just how much our bodies have changed in those recent decades.
It's very funny that you mentioned that because I give sort of I run a medical weight loss program, which is really a metabolic health program. I just call it weight loss because that's why people think they're finding me. I actually don't even care if they lose a pound. I want them to get healthy and live their best lives. But in that introductory session, I actually show a picture of a beach in Brooklyn, New York in the 1970s. I actually lived there at the time. And then I show, and you're exactly right, there's not a single person in that photo who has overweight or obesity. And it's a very, very crowded beach. I mean, there are probably 1,000 people in that picture. And then I fast forward to January of 2020 when I took a cruise right before the pandemic hit. And I took a picture in St. Thomas that I thought I was taking of the beautiful scenery. And when I came back home, and I looked at my pictures, I remembered seeing a picture, like you said, from long ago that showed how there was really no obesity at the time. And I looked at my picture, and there were a whole bunch of people standing in the water and on the beach. There really wasn't a single person who did not have overweight or obesity. And even the ones who looked thin, if you kind of zoom in, you saw they had abdominal obesity. So they might look thin, but they had a pot belly, if you will. And so I actually show both of those to show what's happened, pretty much in 40 years, a little more than 40 years. The scenario has completely changed.
It's such a stark contrast over a relatively short period of time. How does a low carbohydrate diet, which I know you are a proponent of because you've been on it yourself for a few years now, how does that help people who are struggling to manage their weight?
More than a few years. I've probably been on it for about 13 years now. And I actually, as a physician in internal medicine, prevention is kind of like, key to what I do. So I have always, since the first day I practiced, talked about diet and exercise and how to get healthy. And when I got to be middle-aged and the advice I had been giving to my patients for decades no longer worked for me, I didn't realize that it wasn't that my patients weren't following my advice. My advice was wrong. So I kind of looked to figure out myself how to lose weight. I found low carb keto way of eating. It's interesting because prior to that, I kind of felt like I had to be hungry for something to work. So if I wasn't hungry, it wasn't going to work. But of course, because I was hungry, I always gave it up. And when I found this way of eating, it literally felt like magic because I was full all the time and able to lose weight. That was a huge paradigm shift. So yeah, I've been doing it for a long period of time. I mean, there's so many components to your question. How does this way of eating help people? Well, if we look at what hasn't helped people over the last 40 plus years, it's the processed packaged food that when you take the fat out, sugar is put in its place and it's addictive, right? So there are actually food scientists that sit behind closed doors. They took the playbook from the tobacco industry. In fact, the tobacco industry companies, for the most part, have bought a lot of the food companies because, tobacco is not as sexy as it was once upon a time. And so they're putting the same playbook now that they did with tobacco and trying to make foods as absolutely addictive as possible. And they also make them as cheap as possible. And so a lot of my patients actually don't have a whole lot of money. And so they may gravitate towards some of the things that seem filling and cheaper, but in effect, they actually make them hungrier. So when you eat sugars and starches, especially the processed ones, and your blood sugar goes up and then comes crashing back down, it makes you hungrier and it makes you crave more. And you crave the very thing that you just ate, the sugars and the starches, to get your blood sugar up quickly. This is all sort of baked into us evolutionary wise. And so they're caught in this cycle of eating sugars and starches. And of course, starches, a lot of people don't know this, turn into sugar in your body. So people think, well, I've really given up the desserts, but they're still eating pizza and pasta and potatoes and bread and crackers. And they're wondering why they're not losing weight and why they're still hungry all the time. It's because a piece of bread and ice cream tastes different on your tongue, but they look the same into your body. They both turn into simple sugars. So it's keeping people hungry and craving all the time. And so a low carb diet, it's not that it does something magical other than removes all that junky processed food. And you say, well, is bread really processed? Are potatoes processed? Is fruit processed? And all those things turn into sugar. And I would say yes, because if you look ancestrally at the grain that we use to make bread, it's completely different. If you look at what fruit looked like ancestrally, it's completely different. I mean, we've made fruit into candy. And ask anybody what happens if they have diabetes and they're wearing a blood sugar monitor and they eat a banana. I mean, their blood sugar spikes. And so there's a lot of misinformation out there, 5 servings of fruits and vegetables a day. Well, that's like, apples and oranges, if you will. Those are both fruits. Vegetables are nothing like fruits. Fruits will absolutely spike your blood sugar. Vegetables with a lot of fiber and water, the non-starchy vegetables, if you will, really won't spike your blood sugar. So, and most of my patients aren't eating 5 servings of fruits and vegetables. They're eating 5 servings of fruits and very few vegetables.
You were talking about cravings there. I spoke with a doctor a few weeks ago who treats people who are addicted to highly processed foods. And it's really astonishing just how much people crave and desire these quote unquote foods. She actually referred to them as food-like substances, and I've heard other people refer to them as frankenfoods. But I think a really great illustration of where we are when it comes to food today is when you look at something like bread traditionally made with a couple of ingredients. But now if you go to your local supermarket, it has 15, 20 ingredients on the outside of the package. So people are really up against it when trying to deal with these cravings and trying to overcome this unhealthy relationship with food.
Completely agree. And when people come to see me, that's one of the first things that I say is, we really want to help you with your relationship with food. We don't want you to be on a diet because that's something you get on and something you get off. And actually what I say is I want you to stop dieting. It's the diet culture that has really become a problem where people are so unsuccessful because we've not given them the tools to be successful. And so they're chasing after this shiny thing, that shiny thing, this shiny thing. And, I have a friend who did this, and they're trying to take themselves and fit them into some kind of diet. I just had a patient that I saw yesterday. She told me that it was her first visit with me. that once a month she does the watermelon water diet. And she's at her heaviest weight ever. I'm like, well, how's that working for you? She said, well, it's not really. I'm like, okay, let's just stop dieting. Let's figure out how to 90% of the time put the foods that are going to help you reach your goals in your body and make you feel good and make your brain strong and make your body strong. Unfortunately, we got to save a little bit of that 5 to 10% for some of those other things, because that's just the nature of our living. You know, if I could put everyone on a keto diet and they can stay on it, is that the optimal way of eating? I think probably so. Unfortunately, after 11 years of practicing, and I really find the best way of eating is the one that the patient can stick with. I teach them a low carb diet and then, or like low carb way of eating. I really try and remove that word. And then I try to help them figure out how that fits them, not how they can fit some way of eating.
I spoke with an expert recently, at this time an expert in physical fitness, and I asked him this very question. I said, if you were going to advise people to do one exercise and one exercise alone, what would that exercise be? And he straight away said, the exercise that they will actually do day in and day out. So the exercise they commit to doing. So it's interesting that you're singing from the same hymn sheet, albeit in a different context. Let me ask you this question. Is it possible to cure obesity?
Yes, but it's a very multi-pronged approach. And I don't think there's a cure. I think that it can be managed. And maybe we can put everyone in remission. I mean, we know there are a lot of genes that are really associated with this disease as well. There are some gene companies that are doing a lot of gene testing, and we're starting to see, I mean, you look at a family and you see everyone in the family has weight issues, and there's more to it. I mean, what some people think is, oh, they all have a very unhealthy diet. But there's definitely a genetic component. So, I mean, in order to do the multi-pronged approach, I mean, we'd have to pretty much take everyone and sit them on a desert island where they had to, fish and farm for their own foods, and get rid of all the food companies and the food that we're feeding people in schools. And I mean, we're creating a nation with the current dietary guidelines of kids that are going to have future issues because, I mean, they pizza and pasta and hamburgers and French fries for lunch at school. I mean, it's insane what they're feeding kids at school. Although some schools are taking matters into their own hands and actually starting to have their own farms and things like that, which is, I think, a great step in the right direction. But until we hold food companies and the government responsible for changing what is on our plate and how much foods cost, and these foods that we're all paying the price of it, like when people say, oh, well, that's so much cheaper. I said, look, you're going to pay the price. You pay it now or you pay it later. And of course, I spend time teaching my patients how to eat healthy on a budget. So it's not like it has to be more expensive. But in a lot of people's minds, they can get, 2 bags of chips for $1. But to get, a hamburger, like hamburger meat or cheese, is more expensive. So they're going to get the 2 bags of chips for $1 because they think that's going to fill them up. So we need governmental regulation. I actually had the opportunity to go to the testimony for one of the previous U.S. dietary guidelines, where they actually make the next set of dietary guidelines, which happens every 5 years. I'm guessing mine was probably 10 years ago. And it was a shocking experience. They had, maybe 100 people. You have 3 minutes apiece. I was talking on making sure the low carb diet is part of the options for Americans to have as a potential healthy way of eating. There was the snack lobby there, saying why it's so important that Americans snack. And the food companies all had lobbyists there, and it was really, really shocking what is put before these people. Many of them who have a lot of secondary interests as well. If you look at all the different conflicts of interest, they're long. And that's the other problem. There's so much conflict of interest in who's making these guidelines, the food companies' input, and things like that. And nutritional research is really, really hard. Most of the research we're looking at is what we call observational, because in order to do good studies, They have to be randomized, controlled, double-blinded studies that happen for a long period of time. We know changes that happen in our bodies due to what we eat, we don't see in 2 weeks or a month. It could be 5 years or 10 years. So to do really good studies, we have to sequester people, keep them in-house so we really know what they're eating, and follow them for, 5, 10, 15 years. Clearly, that's not going to happen. So we do really, really short studies, which don't always tell us much. We do studies in animals and try and say, well, that may have something to do with humans. And then we just observe populations of people. Some of the studies will look at one time point and then follow these people for 10 years. Are they still eating the same way they were at that one time point 10 years ago? So, and then there's certainly a lot of conflict among, physicians and researchers about what the optimal diet is. But I can sure tell you what the optimal diet is not. And I think there's very little disagreement among health professionals and researchers about what it is not. And let's at least start there, right? Because we can all agree to that. Let's get the crap. I don't even like to call it FOOD because it's not. Let's get the crap out of the system. Let's get the sugared sodas out of the system. There is no place for soda in a healthy diet or sweet tea or any of these sugared beverages. And people even have a misconception about juice. Juice is as unhealthy as the rest of it, has just as much sugar. A few vitamins, but just as much sugar.
Let's talk about these strategies in your clinic that you use. As you said earlier, you focus on promoting metabolic health first, as opposed to weight management per se. But you emphasize celebrating non-scale victories. What are non-scale victories and why are they so important?
Sure. So losing weight is hard. Anyone who has tried it will tell you it is hard. It is not easy. So if you don't have some clear vision as to why you want to do this, it's going to be difficult. So we really want to celebrate all those other things because people come in, remember, we call ourselves a weight loss clinic, and people that come in are laser focused on the scale. Like I said, I don't really care about the scale. I want you to get healthy. I want you to live your best life. I want you to be able to move and exercise and sleep well and manage your stress. And we live busy, chaotic lives. And if you're filling your body with crap, it's going to be really difficult to manage that busy, chaotic life. Unfortunately, that's why many people use that as a reason. I'm too busy to do this. And I say, well, flip that around. You're so busy, you need to do this and eat healthy, because if your car's not acting quite right, you're not going to go get that cheap gas on the corner that's half price because it's half water. You're going to put some good gas in your car. People forget this is the most important vehicle that they have, and what they put in matters, and we try and emphasize that. So they're laser focused on the scale, and sometimes the scale doesn't move. People come in and say, what's my goal weight? I'm like, I have no idea. I have no idea what your body is capable of. When you go to sleep at night, I want you to think, did I put good food in my body? Did I move it around? Did I try and manage my stress? Did I try and work on my sleep? If you did those 4 things, you've done a great job today. What that little box is going to do, I really have no idea. So starting to have them look at the other facets of their life that are improving can really help, especially when the scale doesn't move. And sometimes, I have the chills right now, sometimes they're so striking and empowering. And we have this big Facebook page. And I have this, I actually cried when I saw this. One of my patients who's lost a substantial amount of weight got on an airplane and actually videoed herself sitting down, not only not having to ask for a seatbelt extender, which, by the way, is incredibly demoralizing. And by the way, we know what's happened to our weight. We've never changed the size of those seatbelts over all these years. So lots of people have to ask for extenders. Let's change the size of the seatbelts. But she said, not only did she not have to ask for that, she showed us how much extra room she had on her seatbelt. And then she showed herself putting her tray table down. And she was never able to do that before because her legs were so big, the tray table was on an angle. And she said, y'all, we're in the South here. She said, I would scream, but I know I would scare everybody. And she just videoed this and put this on our Facebook page. But it's things like doing things with your children or your grandchildren, going on roller coasters, fitting into something that's in the back of your closet. the number one thing is having more energy. I don't really emphasize, especially at the beginning, the exercise, because when you have a lot of weight to lose, it's hard to exercise. You feel short of breath. You don't necessarily want to go to the gym. You feel judged. And when you start to lose weight, your body just wants to move because it feels better. And so people start saying, I'm going to the gym, or I'm walking, or I'm able to go upstairs without being short of breath. I mean, basically, I feel like I cure cancer every day because obesity is a cancer. It affects every facet of a patient's life. And when you help them with that and help them to start to feel better and have a healthier relationship with food, where they're not thinking about food all day long because they're hungry all day long and they're trying to white knuckle not eating it, but it's just gnawing at their brain, their lives change. People get jobs. They change their relationships. I've been practicing medicine for 35 years, and this is the best job I've ever had. I am filled up every single day by the amazing journeys of my patients.
Well, there's proof now, if it was ever needed, of the transformative effect of the medical profession if it is done right. Dr. Wolver, one of your mantras, or your Wolverisms as you call them, is this: that weight loss is 25% what you eat and 75% what you think. For people out there who struggle with emotional and stress-related eating, and there are many of those people, what advice would you offer those people to help manage these all too familiar triggers?
1 of 4 people, at least, that come to see us actually have an eating disorder. So unfortunately, a lot of primary care doctors don't even know how to evaluate for that. And they're just handing out, all the weight loss medications now, which I don't want to disparage. I think there's a great place for weight loss medications, and we could talk about that if you like. But none of it will work if you really have an eating disorder. And so if what you've done and you've tried and tried and tried is not successful, it's not a bad idea to really see someone who specializes in this and figure out, do we have an eating disorder that really needs to be treated before you're going to be able to be successful? I think that's very, very important. But lots and lots of people, don't actually qualify for an eating disorder, but have that, as you said, emotional eating. So working on depression and anxiety, which we do a lot, seeking a therapist to figure out, how do I deal with these emotions in a way that I'm not turning to food? What can I substitute for dealing with these emotions? I call food a destructive way to manage emotions, and I help patients to find constructive ways to manage emotions. Oftentimes, it's going to take more time than I have being able to see patients, and we'll be working with a therapist or a coach or a dietitian, every week or so. I say a dietitian who practices low carb kind of stuff, but dietitians are also really helpful at coaching. So working with someone to really learn the techniques. And I think when you said 25, 75, weight loss is a learned skill. A lot of people don't realize that. And so they just change their food. They're probably successful because they're all motivated, all in for a period of time until they can't white knuckle it anymore. Our bodies will fight us for weight loss. That's something we call metabolic adaptation. Our bodies are not designed to lose weight. If you're a caveman and you lose weight, something is wrong. And so we have all these mechanisms that push against that to try and get us back to where we are. So you have to learn, even with bariatric surgery, with changing your diet, with medications, eventually your body's going to push against you. You have to learn how to recognize that. You have to learn to recognize what you do in those situations. And so you have to learn the techniques and practice them. Am I hungry? Am I craving? And there are lots of good books. I could mention some of them if that's something that I could do here. So one of my favorite books is called The Beck Diet Solution. So Beck is the father of cognitive behavioral therapy. He just passed away at 100. I think it was last year or the year before. And he wrote this book. Actually, his daughter wrote the book, Judith Beck, called The Beck Diet Solution, Train Your Brain to Think Like a Thin Person. There's some stigma in the book, and I don't like that part, but the thought process of the book is phenomenal. In fact, it was out of print, and I think my group has ordered so many of the used books. It's back in print again. because I think it's actually a 6-week program, diet agnostic. So it really doesn't teach you to have a diet. It teaches you how to think. So cognitive behavioral therapy is a behavioral technique on how you think and frame things. And I think they do a fabulous job in learning all the skills of weight loss and knowing it's very easy to know what to eat that's going to make you healthy and what you eat that's not making you healthy. Even though I said there's some disagreement about the specifics of that, it's really hard to know why you're struggling to do that. What you know you need to do, you're over here, you want to be over here, you know what you need to do to get over here, why can't you do it? That's the thinking part of it. And so we really have lifestyle coaching classes, health coaching. There's certain books that we recommend, certain podcasts that we recommend that are really all about the mindset. Just some of the skills that are taught in that back book. One is to know the difference between hunger and cravings, and actually to teach your body that hunger is not an emergency. Back to the caveman brain, if you got hungry, you need to drop what you were doing and forage for food because you didn't know if it would be 5 minutes, an hour, 5 hours, 5 days. So it was an emergency. So baked into our brain is that hunger is an emergency. And some of my patients really come to me with that fear that hunger is going to get so unmanageable that if they don't eat, it's going to be highly distressing. And they have them do this little experiment in the book to teach their brain that hunger waxes and wanes, as do cravings, even if you don't give into it. That's a really important thing. Another skill is learning to leave food on your plate. How many of us came from the Clean Your Plate Club because some kid was starving in some foreign country, or if you don't clean your plate, you don't get dessert. So we've disordered eating at a very young age. We fall down, we get a cookie. I mean, there's the start of emotional eating. Obviously, if I get hurt, sugar makes it better. So we have a lot of things to undo, and I think that book helps.
I really do like this holistic approach, the emphasis on mindset, on psychology, on our relationship with foods and our relationship with eating. And I suppose in that context, I'd love to hear your views on this new generation of weight loss drugs, because whenever I first heard about the Wegovy's, the Ozempics and the semaglutides of this world, I thought, hold on a second, does this not divest people of personal responsibility when it comes to managing their weight? And so then I spoke with people who know an awful lot more about this subject than I do, and they said to me, hold on a second, if we have people come into our clinic and they have tried every avenue possible to lose weight, and if prescribing this pill keeps them alive, well, then we will absolutely prescribe it to them. So in that context, I'd love to hear your thoughts on these drugs.
So I'm going to take issue with obesity being a personal responsibility. That's kind of what's gotten us into this problem in the first place. Obesity is a disease. I could show you very, very complicated diagrams of the hormonal and neurohormonal disease that obesity is. And we failed people by saying that this is a personal choice. We failed by not changing the food system, and we've blamed them and shamed them when we have given them very poor advice about how to get better. But I absolutely, positively believe that obesity is a disease and needs to be treated as such with a multi-pronged approach. I'll continue in a minute, but I'll tell a little story. I was playing pickleball the other day, which is my passion. And I was walking by some people, and I heard one person say to the other, "Oh my God, you look amazing. You've lost so much weight. How have you done it?" And the other person said, "I cheated. I got on Wegovy." So I backed myself up and I said, "Excuse me, I know you don't know me, but I'm an internal medicine physician specializing in obesity. And I just want to let you know that obesity is actually a disease, and we actually have very effective therapies for this disease right now. So you did not cheat by going on Wegovy. You got an effective medication for the disease you have." But then I said, "However, that donut in your hand, that's the problem." And then she went on to say, "Well, on the Wegovy, I just feel so bad. And so I really can't eat much. And so I figure whatever I can eat is going to be good, even if it's a donut." I said, well, that's a huge problem. And unfortunately, that's a problem I'm seeing in my practice a lot when primary care doctors are so excited that they actually have a tool that is helping patients, but they're not doing it in a safe and effective way. And I've been a primary care doctor, and I get it. We weren't trained on how to really deal with the disease of obesity. So I am actually spending all of my time now outside of my own clinic trying to educate. I've done 9 presentations at state, local, and national meetings this year, mostly to teach people, to teach physicians and advanced practice providers how to treat the disease of obesity effectively. So in my practice, yes, I am seeing people that have tried everything. And a lot of people come in wanting these medications, but I will not prescribe them if they have an eating disorder until that eating disorder is under control or if their diet is atrocious. I said, well, a medication might be something, but I'm not going to medicate you into eating less junk food. Let's work on cleaning up your diet. And here's an interesting thing. When we clean up your diet, you might find that your hunger and cravings are dramatically better. And oh, by the way, when I tell people all of the benefits and then possible side effects, and guess what? This is a lifelong medication because obesity is a chronic, progressive, and relapsing disease. And if we put you on a medication to help treat it, you're going to be on that medication long term because studies show when you stop it, there can be a rapid weight regain. And when I say all those things, people have a little bit more pause about just jumping right on them. So, I'm not going to medicate you into just eating less junk food. So here's a healthy way of eating. Let's get you into some classes. Let's get you into some lifestyle coaching. And let's see you back and see how you're doing. Where are you struggling? If people are really trying to improve their diet and left with a lot of hunger, cravings, what we call food noise, these medications are unbelievably helpful. So I know I stand a little bit different from some of my metabolic colleagues. If I could just change everyone's diet and have them really stick with a low-carb keto way of eating, would that be my preference rather than going on a medication? Yes. But in 11 years, despite initially only teaching a ketogenic diet, many, many people are unable to stick with it long-term. There are people who can't. I've done it for 13 years. So we ask the patient, what do you want to do? If you think a ketogenic diet is consistent with your lifestyle long-term, not as a jumpstart, let's go there. And when you go there, I tell people, you know what? It's as appetite suppressing as any of those medications. So you can do this with food. But what do you want to do? Because I want to help you do it in a way that feels consistent and sustainable. So some people who do keto are really intense about it. So they're intensely in, then they have one thing that's not keto, and then they're intensely out. And they do the cycling thing and they come back, I have to get back on track. I'm like, well, then that's probably not the right thing for you. Let's find something that's a little more sustainable. Let's add a few carbs. What are you missing? You might not be ketogenic. And then sometimes when we add carbs or when people think, oh, I couldn't go keto, and we teach them like maybe a 50-gram carb diet, they come in and they're actually doing a ketogenic diet because they just feel better that way. So I let people be where they think it's sustainable for them to be. And if that includes medication because they have so much hunger and so much cravings, then I feel very comfortable in doing that.
How much is any mention of personal responsibility a contributory factor to the stigma that comes with being overweight?
So you're saying that people think it's a personal responsibility?
No, what I mean is if people feel they are being blamed for being overweight, how does that affect them emotionally?
Oh, tremendously. They've been told that by their healthcare providers for decades. Yeah, and unfortunately, I was one of them. I would talk about the diabetes, the high blood pressure, their heart failure, their knee pain. And oh, by the way, eat less and move more. And when they came back in 3 months and their diabetes still wasn't controlled, their blood pressure still wasn't controlled, they probably gained weight. Well, that's obviously they weren't listening to my advice, right? But actually, I wasn't giving them any appropriate tools on how to, first of all, eat less and move more doesn't work. Exercise does not help you lose weight. Exercise is critically important to good health, but it's how you eat that has to do with weight. Now, exercise is probably very important in weight maintenance, but not as important in losing weight. So I never gave my patients the right tools. After I used to tell them eat less and move more, then I moved to, okay, don't eat anything white. But, it was like lip service onto truly how should they eat? When should they eat? How should they eat? Where should they eat? What should they do to really help them lose weight? So we all were part of the blaming and shaming. They're just not listening. They just want a medication. They're just not doing it right. So I have patients. I mean, just like that one patient in pickleball, I cheated. I went on Wegovy. So we have blamed and shamed patients. I've actually heard knee surgeons who have said, I'm not going to operate on you. You're too fat. You just need to lose weight, and then your knee pain will get better. You might not even need an operation. So we have to give them the appropriate tools and then work with them in the mindset piece to help them to utilize them. They might very well know what to do, but if they're struggling to do it, that's not their fault. So I once had someone tell me something that really stuck with me. If you and your patient come up with a plan for the next visit and goals that they're going to try and achieve, and they don't achieve the goals, it's not their fault. It's your fault. You didn't help them achieve sustainable, correct goals. And what I teach primary care doctors to do is, rather than treating their diabetes, their high blood pressure, their heart failure, their knee pain, and, oh, by the way, eat less and move more, ask them if they want help with talking about their weight. And if they do, make a whole separate appointment to just talk about that. Because when you treat that, all those other things that you've been spending the last decade talking about get better and maybe even resolve. So we have paid the least attention to the most important thing. I mean, all doctors want to talk about is people's cholesterol. A patient could have a BMI in the 60s, and they're honing in on their LDL cholesterol when they're going to die from something because of their obesity, probably faster than they're going to die from something because of their LDL. So we're missing the forest through the trees, and we've got to teach people how to manage this disease that affects all my colleagues in rheumatology and cardiology and pulmonary are seeing patients because of their obesity, and they're treating the end stage of their disease, their asthma, their sleep apnea, their obesity hypoventilation, where they have to have a trach because they have so much weight that their airway collapses at night. But they're all just treating that end stage. And who is treating the obesity that's causing all of these things? So we all have to be part of the solution. There's way too much for an obesity medicine specialist to do alone. So it has to be all physicians and other providers. It has to be the government to change, to tax the heck out of these food companies that are poisoning us, to change the dietary guidelines in a meaningful way. The dietary guidelines are only for healthy Americans, which is less than 10% of all Americans. More than 90% of Americans have at least one feature of the metabolic syndrome, so are not considered metabolically healthy. Sometimes I feel like I'm the only sane one and everyone else is crazy, or am I crazy and everyone else is sane?
We'll come back to dietary guidelines in a moment. For the audience's benefit, I want to dive deeper into the actual low-carb diet that you are a proponent of and that you believe people should be really adopting the world over. What does the diet look like? We know what it shouldn't look like. It doesn't include any of those highly or ultra-processed foods or food-like substances. So what really should people be looking for whenever they go to the supermarkets? What should they be grabbing off the shelves?
So, it's something that people have heard for years, shop the perimeter of the supermarket. It's so, kind of like the low-fat era in the 80s. And then we got all of those boxed up fat-free cookies. You can eat as many as you want. It's fabulous. Now we're getting all those keto products. So I don't love those either. What I teach patients is real whole food. As few ingredients as possible. One is preferable, so, meat is meat. There are no other ingredients. So it's non-starchy vegetables. It's any kind of protein, meat, pork, fish, chicken, eggs. Eggs is one of nature's most perfect foods. And you can certainly understand why patients are confused because, all we get is sound bites of headlines and people who are reading studies, and they just pull one thing and they don't even know how to appropriately read a study. So today eggs are good, tomorrow they're bad, the next day they're good again. So, but eggs and cheese, and I also think that full fat dairy, cottage cheese, and full fat plain yogurts. That's pretty much it. Some berries, some nuts, but careful with those because people tend to overeat them. And then again, depending upon sort of your metabolic makeup, how healthy metabolically you are, you may be able to add some other, maybe starchier vegetables, maybe some legumes, some lentils, some beans, depending upon where you are on your metabolic health.
Well, here's a question I put to your mentor, Dr. Eric Westman, when he was on the podcast. We have spoken about the damage the historical dietary guidelines have done to people's health, like the low-fat craze of the 1980s. How do you think future dietary guidelines should be shaped so as people's health will be optimized?
I mean, personally, I think they should be exactly as I just said. Real food, get rid of all the boxed and the bagged and the all of the things with ingredients that you can't pronounce. I mean, if I had my way, we would hold all the food companies liable, and we have to make Whole Foods way cheaper. And just like they pay tons of money for the damage that they did in the tobacco industry, they need to be paying tons of money to subsidize good food now. And we need to get rid of all that junk crap food. Now, we've celebrated with sugar since we're little, so it's not going to go away, but we need to make those things much more expensive. And when our grandparents or our great-grandparents ate something with sugar, it was a treat. It was a once in a blue moon, a birthday, a something. We now have people who eat, junk food and desserts after every meal, after breakfast, after lunch, or after dinner. Or, in fact, the meal itself is dessert. A cinnamon bun. That's not food. That's a treat that should be had once in a blue moon. So we have to change the conversation. We have to start when the kids are young. A lot of times I'll get a patient saying, well, how am I going to eat this way with the family? I say, well, honestly, your family needs to learn to eat this way. But, I have all these snack foods for my kids in their lunch boxes of like, put an apple in. They don't need all this stuff because you're raising them to be my next patient. So, don't do it all at once because kids will, put their heels in and scream back. And we shouldn't have really good foods or bad foods because that sets up for eating disorder. I think any food is okay once in a blue moon. But not, like I said, 90 to 95%, we should be putting the food in our bodies that make it go well, make our brains think well. Sometimes I'll appeal to the patients and say, are your kids in sports? Yeah, my son plays football, my daughter's in dance. Like, well, what they put in their bodies matter about how effective they're going to be on the playing field. Again, I go back to the car analogy, and then they really start to understand. And then sometimes I hear, well, my husband, like, he can eat anything he wants. He's thin as a rail. I'm like, again, what you put in your body matters. I don't care what the outside looks like. Trust me, if they're putting junk food in their bodies, the inside's not looking very good or will not continue to look good. So I can't say it enough. What you put in matters. How well, people eat all this junk food and then they're shocked when they get these diseases. I'm like, what you put in matters. I can't say it enough. Care about yourself enough. I'm too busy to be able to focus on this. Well, if you don't focus on it now, you will be forced to focus on it later. And unfortunately, at that point in time, it may not be reversible.
You're raising them to be a patient. Those are powerful words, and really put the subject, I think, into context, especially for parents.
Yeah, you just got to help them see things in a very different way. You have to understand, I'm seeing patients maybe for the first time and maybe in their 50s and 60s, and people have told them all kinds of different things about food for decades, and they just don't even know what to believe. Sometimes we'll have this whole conversation and then they'll come back and they say, well, I tried this diet. I'm like, did we talk about where did that come from? So there's a lot of reframing,
Dr. Wolver, you have a website or a presence online?
Well, I don't really have a website. It's a site for my program. I'll send you a link, but I can only see people in Virginia. I know you have a worldwide audience, but We do telemedicine, but it's only in the state of Virginia. So in the U.S., it's where my license is, where I can see patients. Now, I can come to Ireland and I can see patients in Virginia, but my patients have to be in Virginia. So I don't know how helpful it would be for your worldwide audience. If you really want to learn more about sort of low carb and keto, I would certainly on a population, a worldwide population base, refer you to Dr. Eric Westman's wonderful Adapt Your Life Academy and his wonderful book, if you want to learn more about low carb eating, End Your Carb Confusion, which is a wonderful, wonderful book. If you want to learn more about how we kind of got in this pickle and how we're supposed to eat, all of Gary Tause's books are phenomenal. But it's easy to see where patients can get confused. There are so many, there's so many vegetarian and vegan activists that are as passionate as the low carb community. And so, who your friends are, what you do. I mean, when people go vegetarian, they're going to get healthier. When people do anything, they're going to get healthier if they're not doing the standard American diet, right? So that's a huge thing in research. I always ask my learners, my trainees, you always have to ask yourself, compared to what, right? So if you're taking people eating the standard American diet, 60% processed carbohydrates, and compare that to anything else and reduce those processed foods, you're going to be healthier. So if people try something and they say, wow, I really am healthier. Is it the healthiest? Who knows? You're at least healthier. See how you do. And then if you run into trouble, see what else is out there. Do you have to, there are a lot of people who sort of biohack themselves and figure out how they feel best. I do have some patients come to me say, I don't feel when I eat meat. And they say, so I can't do a low carb diet. I said, oh, a low carb diet isn't what we're adding to your diet. It's really what we're removing. Eat what works for you. Figure out how this machine runs at peak efficiency and then stick with that. And that means your metabolic markers, how you feel, how you're able to exercise, sleep, think. I mean, people who eat junk food all day oftentimes wake up in the middle of the night because they're starving because their blood sugar dropped. And then they eat at night, which is terrible for acid reflux and all kinds of things. And when you change the way you eat, it changes everything.
I love your message and I love how you communicate it. Dr. Susan Wolver, it's been a joy.
Thank you so much. You are a delightful interviewer.
And thank you very much. If you enjoyed that video, I know you'll get some value from this video right here.